I see you are muted.
Sincere apologies. We are now back online. To our host, the Premier of KwaZulu-Natal Province, the Honourable Sihle Zikalala, Siyabingelela Khuzeni, the President of ICASA, Professor John Idoko, the ICASA Board, the Society for AIDS in Africa, and a special greeting to the ICASA Director, Mr. Luke Aman-Potea, the LOC co-chair, Dr. Fikile Ndlovu, and the entire LOC, including the ICASA Secretariat, as well as the South African LOC Secretariat, co-chairs of the various conference tracks, our esteemed guests, both virtual and physical, members of the media, all ICASA delegates present in the room, good morning. My name is Dr. Sihle Zikalala, the ICASA LOC chairperson in South Africa for 2021, and I am your program director for this closing ceremony. Outside of ICASA, I am the CEO of the South African National AIDS Council, a national body which is established to coordinate the national response to HIV, TB, and STIs in the country. We sit within the presidency and we are chaired by the Deputy President, the Honourable Didi Mabuza. Let us first start by thanking our rapporteurs who have really given us a good sense of the emerging themes of the conference and some of the potential areas of focus and policy implications as we race towards 2030 in line with this conference theme. Next, we are going to hear perspectives from a young woman openly living with HIV, Ms. Bonisiwe Mathebula. I am certainly looking forward to her reflections, since we know that adolescent girls and young women are hardest hit in terms of new HIV infections, not only in South Africa, but in many parts of the world. Ms. Bonisiwe Mathebula, affectionately known as Bonnie, is a beautiful 19-year-old who was born with HIV. She is now a peer educator. She is a short champion who provides psychosocial support for other young people living with HIV. She also represents adolescents and young people living with HIV in Gauteng, nationally, in Africa, and internationally. Bonnie, wozokhuluma nathi sis. As adults, we have a lot to learn from the youth. At times, most answers to our challenges actually lie with the young people. Please go ahead.
Greetings to all members of the session program, all protocols. As you can see from the screen, I'm Bonisiwe Mathebula, a 19-year-old born and living with HIV. I'm from Tolulwazi Phakathi, the NPO that provides psychosocial support to adolescents and youth living with HIV. We also have parents disclosure and HIV prevention program, representing adolescents and youth living with HIV in Gauteng, South Africa, Africa, and internationally. Next slide, please. Next slide, please. We all know that there are high percentages of adolescents and born and living with HIV in South Africa. The HSRC study on shows the quota of female adolescents living with HIV 15 to 19 years were attending school and had not completed grade 12. Amongst adolescents out of school, all males adolescents living with HIV and females adolescents living with HIV were not employed. Some are exposed to GBV and experiences stigma, discrimination in families, communities, and even our local clinics. In 2012, HIV prevalence amongst 15 to 19-year-old families, adolescents, was 8 times higher than males. The study shows that 62.3% adolescents living with HIV know their status, of which 95.4% are on treatment and 78.1% are virally suppressed. Next slide, please. As an adolescent living with HIV, we go to the clinics and experiment judgment by securities, cleaners, and nurses, even our doctors. For example, if I may go to the clinic and tell a nurse or everyone that I'm HIV, they will judge me, say I was engaging to sexual intercourse. Since COVID-19 pandemic, people living with HIV are separated from other patients while standing in queues outside the clinics, which contributes to stigma and discrimination, and it can lead to many percentages of adolescents living with HIV loss to follow. That's why most of the youth are scared and afraid to go to the clinics. Some end up not even going to the clinic at all. The life orientation curriculum curriculum does not include adolescents and youth living with HIV, which makes us feel excluded in such a way that it doesn't educate more about how to live with HIV. Since COVID-19, there are no support for adolescents living with HIV, such as support groups and sessions. To make adherence or attending clinic must be refreshment that will motivate instead of waiting long hours. The recommendations are such as Shontwana should be expanded, which is used to engage with adolescents and young adults living with HIV. Programs such as Shontwana should be expanded, which is used to engage adolescents and youth living with HIV. Shontwana it covers the issue on HIV care support, including prevention. The Shontwana program encourages adherence by sending reminders, SMSs on Facebook and WhatsApp. Encourages adolescents, youth living with HIV through a motivational newsletter. Other recommendations: trainings for nurses or peer lead approach must be included, including HIV management and treatment in the LO curriculum. Strengthen adherence and support groups. Share information on reporting violation in clinic, communities, organization, and even our schools. Shontwana is a program we use to engage adolescents aged 15 to 19 years old. We normally have camps, groups, adherence groups, and even prevention groups for prevention. We also have the CATS program, which means community adolescent treatment support, whereby, for example, in my location, I have 20 adolescents living with HIV that I'm taking treatment with. Every time we send each other reminders to, like, such as please call recharge. Thank you. For more information, please reach our page on Tolulwazi Phakathi. Thank you.
Thank you so much, Ms. Matebula, for those eye-opening remarks. Ngicela siphinde simshayele ihlombe. Oni, you are a very brave young woman. Please continue to shine your light in every space that you occupy. Next, we have got the president of the Society for AIDS in Africa, who are the custodians of the ICASA conference, Professor John Idoko. After his remarks, Prof will also do the handover of the ICASA 2021 Best Abstract Awards from all the tracks. Briefly on Professor Idoko. Professor John Idoko trained in internal medicine, infectious diseases, and immunology of infections, and has been an HIV patient since 1995. He was principal investigator of the Harvard University AIDS Prevention Initiative under PEPFAR in Nigeria. Among his many prestigious roles, which are too many to mention, Professor Idoko was president of the Nigerian AIDS Research Network, chairman of the Nigerian National Antiretroviral Committee. He is co-chair of the newly established West African Infectious Disease Institute and serves on several boards, including the Governing Council of the International AIDS Society. His research interests include clinical trials on antiretroviral drugs, adherence to antiretroviral therapy, tuberculosis, hepatitis co-infection, resistance to antiretroviral therapy, social and behavior issues in TB and HIV, and models for scaling up comprehensive HIV services. He has got over 70 publications in peer-reviewed journals and has contributed to several books. Prof, may you please proceed with your remarks and then immediately conduct the handover of the awards. Thank you so much. Over to you, Professor Ido.
Thank you very much, Dr. Tembi. I'm actually flabbergasted by your introduction. Well, thank you very much. I really thank you for it. Excellency Premier of KwaZulu-Natal, Mr. Sihle Zikalala, senior government officials present, members of the international community, executive directors of organizations of the UN system, my colleagues, board members, esteemed members of the ICASA2021 Steering Committee, members of the local, national, and regional civil society organizations, colleagues, distinguished delegates. Finally, I must not forget to acknowledge the people who were at the heart of this conference that made it happen. The ICASA director, Sir Luke Odell and his team, and the LOC chair, Dr. Tembi Kulu and her team. Let me also recognize our co-organizers, Government of South Africa, WHO Afro, UNAIDS, UNFPA, Mylan, and especially our distinguished delegates. Without you, there is really no ICASA 2021. You made it happen again in Durban. Can you give them a round of applause, please? As you all are aware, this ICASA 2021 is more than unique. It's our first virtual ICASA with 3,426 participants from 67 countries. The conference provided 1,144 virtual scholarships and 110 in-person scholarships. About 450 delegates came to Durban before we reverted from hybrid to the virtual conference. our sincere apologies to them. As our first virtual ICASA, we'd like to apologize to all delegates that have experienced some challenges, either due to internet or to other related issues. The past 6 days have demonstrated the unique nature of the International Conference on AIDS and STDs in Africa. This 21st edition is coming to an end today, Saturday, 11th of December, 2021. The unique nature of ICASA has always been the interaction between the best scientists across the globe, government, high officials and policymakers, with grassroots organizations spread across Africa and the rest of the world. In the last 6 days, we have shared knowledge, best practices, and updated ourselves in 15 plenary sessions, 78 abstract-driven sessions, 11 non-abstract-driven sessions, 18 special sessions, 4 workshops, 3 pre-conferences, 63 satellite sessions, 24 community village sessions, 287 e-posters, supported by 415 speakers. In doing so, I believe we have more than met all our objectives for this conference. There were indeed great talks, questions and answer sessions, and great comments through all these sessions. The outcomes of the discussions over the past few days have indeed highlighted significantly 4 main points out of 7. First, the challenges posed by the COVID pandemic and how to translate the knowledge and shared experience into action to bring the epidemic to a halt in our various countries. Second, the impact of the COVID pandemic on our health systems and other epidemics and diseases, of course, including HIV, TB, non-communicable diseases, and how to mitigate this impact. 3, containing current and future epidemics and pandemics on the continent through greater and strategic efforts to manufacture medicines, diagnostics, and vaccines on the continent. And last but not the least, mobilization of domestic resources from both governments and the international community to tackle both the COVID and other epidemics in an integrated manner. It is believed that this will ensure that the objectives of ending AIDS 2030 will indeed be realized. As we move forward, allow me to pose 1 or 2 important questions. First, with the raging COVID pandemic, how do we enlist the trust of our communities to accept the available vaccines, given the hesitancy and the rejection across our continent? And how do we ensure that people at our communities adopt the simple but life-saving COVID protocols? And the second is, we've heard a lot in this conference about the need for Africa to manufacture its medicines, diagnostics, and vaccines. What should we do to bring the political capital to ensure collaboration and partnership between governments, WHO, researchers, and the industry? I believe we need a lot of advocacy. And I can assure all our participants that SAR will be at the forefront of this advocacy. In conclusion, The fight against infectious diseases in Africa must be fought with more vigor and sustained through scientific research and technology and strengthening of our various health systems. All hands must be on deck, including our brothers and sisters in diaspora. My last words of appreciation go to the President of the Republic of South Africa, His Excellency Cyril Ramaphosa, the Deputy President, the Honourable Minister of Health, the Premier of KwaZulu-Natal, and the good people of South Africa for their hospitality and for supporting this conference, which indeed has turned out to be a success. I thank you all for your participation, and I wish all of us safe trips back to our cherished and to our countries, including all our cherished delegates. Merry Christmas, happy and healthy 2022. Thank you all, and God bless you all.
Thank you so much. If you would like to proceed with the issuing of the awards, I'd be happy for you to continue, Prof. Thank you.
Thank you very much, Program Director. Unfortunately, none of the awardees is present with us, so we've decided to communicate with them and then present the awards post the conference. Thank you very much. Over to you.
Thank you so much, Prof. Yeah, I think this virtual platform does take us a little bit off guard. But Prof, I really want to thank you for your leadership throughout the conference. It really has been phenomenal, despite the challenges that we've encountered. We also want to thank our political principals who've really supported us in making this conference a success, despite the challenges that we all faced. And I think I also want to thank our delegates for understanding the difficulties that we've gone through, but for still making sure that this conference continued to be a success. So to the International Steering Committee of ICASA, to the board of ICASA, to the entire SAA body, we hope to call on your guidance and wisdom in future endeavors, because one of the key clauses during this conference was future pandemic preparedness. And it's clear that Africa has to work together to lead itself out of the AIDS pandemic, but also to get ready for any future pandemics. So we are going to be certainly working with you closer as we move forward. I would like now to call on our gracious host, the Honourable Premier of the province of KwaZulu-Natal, Honourable Sihle Zikalala, to give us closing remarks for the conference. Mr. Sihle Zikalala is an ANC leader, a husband, and a father. He is driven by the ideals of a united, non-racial, non-sexist, equal, and prosperous society. Born in Indwedwe in 1973 to a religious family, he grew up to become a humble yet formidable and courageous social activist. From his youth, he was entrusted with key responsibilities within the liberation movement in South Africa, including being appointed as the Secretary General of the ANC Youth League, the ANC KZN Deputy Provincial Secretary, as well as the Provincial Secretary. He is currently the ANC KZN Provincial Chairperson in KwaZulu-Natal and the Honourable Premier of this gracious province of KwaZulu-Natal, which is hosting the ICASA conference. Prior to his deployment as Premier, Mr. Zikalala was the MEC for Economic Development, Tourism, and Environmental Affairs, and a leader of government business, positions which he held with great diligence and passion. Mr. Zikalala is a champion for gender equality youth empowerment, and an advocate for quality education. He strongly believes in education and regards it as an indispensable weapon in the arsenal to advance equality and improve the quality of lives. Mr. Zikalala holds a degree in communication science from the University of South Africa, an honors degree in public administration from the University of KwaZulu-Natal, UKZN, and he holds a master's degree in leadership studies, also from UKZN. Baba, Tabisa, Masila, ladies and gentlemen, please welcome our Premier to please lead us out with a closing comments for the Cancer Conference.
Thanks, Program Director, Dr. Sihle Zikalala. We are grateful and thank you for the manner in which you have steered and gave leadership on this program. The President of the International Conference on AIDS in Africa, Professor John Idoko, South Africa's Minister of Health, Dr. Phahla, the leadership of civil society for AIDS in Africa, members of the organizing committee, government officials who are with us, scholars and AIDS activists, civil society representatives, partners from different sectors, distinguished guests, ladies and gentlemen, on behalf of the provincial government of KwaZulu-Natal and the host city of Durban, we wish to convey our heartfelt gratitude to all ICASA 2021 participants for your every effort in ensuring that the conference was successfully held. A week ago, from the 6th of December, the eyes of the world were on Durban's International Convention Center, which is Inkosi Albert Luthuli Convention Center, where close to 1,000 people were set together to talk about the crisis of sexually transmitted diseases in Africa and the world. The International Conference on AIDS and Sexuality in Africa attracted scientists, academics, researchers, activists, business and senior leaders of government and other key stakeholders from our continent. We gathered at ICASA under the able leadership of the Society for AIDS in Africa, with the aim of making our own contribution toward ending HIV and AIDS and emerging diseases in Africa. In that equation, the conference has not been able to escape the reality that one of those emerging and evolving pandemics is, of course, COVID-19, which now poses a threat to the global effort to end HIV. As we started this conference, we stare in the face of the mounting evidence of the rising number of COVID-19 cases in parts of South Africa and indeed in our continent and the world. We've come to acknowledge that COVID-19 pandemic represent an extraordinary level of uncertainty, not only to us, but the entire world. Addressing journalists in Geneva on Wednesday, World Health Organization Director General Tedros said, with Omicron then having been reported in 57 countries, the list was expected to grow. And Dr. Tedros was, of course, underlying and emphasizing that COVID-19 pandemic is still gonna be with us. We therefore, as the province of KwaZulu-Natal, express our full support for the description of the ban by the President of South Africa President Ramaphosa as unscientific, unfair, and representatives of overreach in time of a global pandemic where we need more global solidarity instead of creating barriers. And we wish to emphasize this point, that whatever happens with regard to confronting COVID-19, the world needs to stand united, and we must also fight vaccine apartheid. Nobody must be discriminated because of COVID-19, and no country must be discriminated. ICASA2021 sought to address challenges relating to HIV and AIDS and related diseases like tuberculosis, malaria, and infectious diseases by strengthening the health system against comorbidities, emerging infections, and all other diseases. Secondly, the aim of this conference was to strengthen and invest in Africa's scientific capacity and manufacturing of vaccine, diagnostic, and therapeutic interventions, identifying in Africa resourced interventions for the most affected, including women, children, adolescents, men, and key population. The conference was also meant to evaluate the impact of COVID-19 on HIV and AIDS response while sharing lessons learned in overcoming barriers in maintaining continuity of care for those living with HIV infections. Of course, the last objective was to evaluate the impact of COVID-19 on the HIV and AIDS and overcoming barriers in maintaining continuity of care for people living with HIV and AIDS. I'm emphasizing these objectives of this conference because I'm fully convinced, having listened to the reports that were presented earlier, I'm convinced that we fully responded to these objectives of this conference. And thus we can collectively declare ICASA 2022 as having met its objective and therefore successful. But there are a number of other interventions that have emerged. And among that is that Africa needs to invest in healthcare and create generational equality. There is no doubt that the collision of pandemics such as HIV and AIDS colluding with COVID-19 requires decisive leadership and collaboration if we are to succeed in overcoming these diseases. COVID-19 has brought to bear the need for our continent to prioritize in investment in healthcare and health infrastructure. Healthcare and the well-being of our population must be seen not only as a human rights imperative, but also as good business investment, because a healthy population is a productive one. We thus want to take lessons from the investment made in South Africa by the private sector, and we want to thank the public and private partnerships that we have explored in South Africa and in the continent. But it is true also that in South Africa, remote rural communities, many
Gordon, we seem to have lost the Honourable Premier.
It's actually on the side. It's on the side of the Premier.
Okay. So should we give him a few moments?
Yeah, sure.
Okay, thank you.
Tell them to allow video. Tell them to allow the video. Yes, disconnect.
Gordon. Oh, Luke, the Premier's team is kindly requesting that you kindly accept them back in. They're trying to rejoin.
Yes, this is open. Let them join. It's open.
Thank you, Honourable Premier. Please proceed. We had lost you for a bit. Thank you.
No, thanks. My apologies for that challenge, but we got disconnected when one was emphasizing that building on the success of this conference, we need to cement partnership between government, the private sector, and ensure that we invest in promoting health population. We say so because in South Africa, we've seen some good examples of this partnership. here in KwaZulu-Natal, we have Inkosi Albert Luthuli Hospital, which is here in Durban. The KZN Department of Health outsourced the facilities management, as well as the procurement and maintenance of the hospital, which include information technology system and medical technology, to the private sector. And all of those who have been to this hospital will attest to the quality of service that is provided. In August 2017, the Ngwelezane Hospital in Mpangeni, north of KwaZulu-Natal, in collaboration with private partners, which is the Joint Medical Holding and the Mpangeni Cancer Association, opened an oncology clinic that is equipped to provide full treatment and care to cancer patients. These are some of the partnerships we are talking about when we talk about the triple Ps. So we would want to encourage the business sector to also invest in health promotion and health as one of those industries that are much needed, especially in this period. Much of South Africa's successful response to both HIV and COVID-19 pandemics derives from strong political leadership and the ability of government to bring together various stakeholders, including civil society, labor, and business, in tackling these diseases. Our government has led from the front and invested heavily in our national response to HIV, TB, and of course, our response to COVID-19 pandemic. Last year, to meet the urgent need for COVID-19 beds, the province of KwaZulu-Natal commissioned 3 field hospitals, which was the first in Claywood in eThekwini, the General Justice Gizengampanza at Ilembe, and Ngwelezane at King Cetshwayo district. And this managed to cap the spread of COVID-19, but contributed effectively to the recovery rate of those who were infected. We are going to move with speed with the implementation of phase 2 of national health insurance. The phase 3 will also start next year, and it will see the improvement in the clinical governance and compliance system. Secondly, the establishment of properly resourced healthcare and health compliance and accreditation units. Thirdly, this intervention will also strengthen the primary health care, re-engineering, and systems. We are ready to ensure that all people of KwaZulu-Natal enjoy universal access to healthcare. As we conclude, we've just started and we will be opening the brand new Dr. Pilsika Isaka Seme Memorial Hospital, which has 500 bed capacity and will provide services to the community of the biggest townships, which is Inanda, Ntuzuma, and Kwamashu areas. We therefore want to emphasize a need for both government and the private sector to invest in the health sector. Compatriots, ladies and gentlemen, we hope that ICASA2021 will rekindle our effort and accelerate our fight against HIV and AIDS. 40 years since HIV was discovered, it is clear that this disease remains a global threat, especially in Africa. South Africa and KwaZulu-Natal still remains the epicenters of the disease. We agree with our National Minister of Health, who argued during the ICASA 2021 that the main action needed to end AIDS are, as a matter of fact, also urgent to end COVID-19 and be prepared for future pandemics. So, Honourable Minister Phahla, speaking on our behalf, emphasized the need to end both AIDS and COVID-19, but to be futuristic and to be prepared to combat any future pandemic. Let us fight both pandemics by advancing a human rights-centered approach. Such an approach must be firmly rooted in science and in the political will to end inequality. Please be safe from these pandemics. And as we conclude, we would want to take this opportunity to wish you well, those who have been here to travel back home safely, and we wish you a safe and peaceful festive season. We're grateful of the success of this ICASA2021 conference. We say that it is in our hands to have an Africa that is free of AIDS by 2030. And Program Director, I wish to thank you and once again thank the organizing committee as well as the ICASA President, Dr. Idoko, for the work that they've done and for the success of this conference. I thank you.
Thank you so much to our Honourable Premier. Thank you to KwaZulu-Natal, and I would say to the city of eThekwini for being such a gracious host. I think KwaZulu-Natal really has a lot to teach the rest of South Africa when you look at programs like Operation Sugumasake, which have shown us the true value of multi-sectoralism when it comes to fighting diseases like HIV, TB, STIs, and COVID, and that the battle is really, really won at community level. And there is so much that not only other South African provinces, but even other African countries and even countries of the world can learn from that approach. So thank you to the people of KwaZulu-Natal that attended the conference. Thank you to the people of South Africa. Thank you to the people of Africa. And thank you indeed to the people of the world that attended this conference virtually, and the very small number that did manage to come and attend physically. As I speak to you, I do have a room that has quite a sizable number of people. So to the virtual and physical delegates that made the conference, we appreciate you because it is the delegates that make the conference. We also want to appreciate the learning that came out of the conference. I think that's what the Honourable Premier was referring to, because it's about the bi-directional learning, for instance, that has come out of the fact that a lot of the successes that we saw come out of the COVID-19 vaccine was work that was done on the backbone of HIV. And it's now that we take those successes and pour them back into HIV in order to bring back the speed so that we don't lose the gains that were made in HIV and TB. So ladies and gentlemen, this sadly brings us to the end of our conference. And I'd like to hope that all delegates from here and abroad travel safely back home. COVID-19 testing information in terms of the delegates that need to produce fresh PCR testing has been communicated both by ICASA as well as by the LOC. And with that being said, I'd like to say, may you all enjoy a safe and joyous festive season. And the conference is hereby dissolved, but I dare not saying that let us all get vaccinated. I'm a doctor, I am fully vaccinated, and if I can do it, so can you. Thank you so much, ladies and gentlemen. A round of applause for the MC. Thank you so much, Honourable Premier, and to the ICASA team. We'd like to end the conference from our side. Thank you.